Well, good morning and welcome. We are officially starting our meeting today. My name is Bobby Spiegel. I am the President CEO for the Corona Chamber. It's a great day of lots of information that we want to share with you in the next couple of minutes, and I'm so glad that each of you have logged on right now. I will be sharing the agenda with my chairman of the board from 2020, a dear friend of mine, Don Williamson, and he is going to start off today by sharing who our sponsor is. Donnie?
Thank you, Bobby. Good morning, everyone. Today's event is sponsored by Awards and Specialties. They're an award and recognition store that sells your basic sport trophies onto complete custom awards for any occasion. This includes medals, ribbons, lapel pins, corporate plaques, lapel pins, much more. I think I said lapel pins twice, but much more. They're also specialized in custom framing and matting and offer promotional items as well. If you go in their store, you'll see all kinds of uniforms and memorabilia that they can frame. It's really a one-stop shop for anything in that category. So thank you to Awards and Specialties for sponsoring this meeting this morning. Back to you, Bobby.
Thanks so much, Donnie. We have some masks that are available for free. This is a partnership that we have with Riverside County. We've all worked very diligently to flatten the curve, and great job by each and every one of you. These masks look like this here, and they're 50 in a box. You know, give us a call at the chamber so you can secure your free mask. I just want to make sure that these masks that we give you are not to be sold. They're for you to use, for you and your employees, and be able to take advantage of those. Donnie, could you share about the flag program, please?
I sure can. You know, the COVID-19 numbers are going down. Things are really improving and looking good. However, our healthcare workers have been on the battlefront for a long time, and they continue to face huge challenges and fatigue. The Corona Chamber Foundation, in partnership with Frontline Appreciation Group of Corona, has been collecting funds to provide meals of gratitude to these tireless workers. You can see on the screen some photos from the great work that they're doing. Donations can be made at givebigcorona.com or by check payable to the Chamber Foundation. No amount is too small. You can also text FLAG, F-L-A-G, to 71441 to have links sent directly to your phone. Back to you, Bobby.
All right. Tomorrow we have our next series of discussions on sales and marketing training by world-renowned trainer, master trainer, Paul Webb. And it is part of the 7 keys to success. I can only encourage you all to jump on and register. For members, it's $25. Non-members, it's $75. This is a partnership that we do by bringing him on. He comes in 6 times a year. Tomorrow, he will be sharing some great information. That starts at 9 o'clock in the morning, but you must register. So please go on to the link that's there, bit.ly/Paul Webb-MAR4 for March 4th. And we look forward for you to all be on that. Donnie?
A very critical thing that every business needs are labor posters. The Corona Chamber of Commerce has English and Spanish labor law posters in stock and ready to go. You can get them through the chamber. They're required by law to be posted and sent to any remote workers you may have. You must have them in the language that the worker prefers, and you must have them posted throughout your complex or facility. And there's really bad fines if you don't. So please contact the chamber today if you need labor posters. Bobby.
Thank you so much, Donnie. And I do want to go and refer to the chat box. Some of you are brand new to Zoom, and you'll see that that is a chat feature that's on your screen. If you want to ask a question of any of our presenters, please take the time to put it in there and look for the one that says Corona Chamber Host and put your question in there. Stephanie will then, after the speaker has shared their topic, we will ask her to repeat any questions or to ask any questions, and then that'll give those presenters an opportunity to share with everyone. So again, just go to the chat box, and that would be awesome if you could do that. So we are going to have our first presenter today, and it is a dear friend of mine. Her name is Michele Nissen, and I've known Michele for a number of years. Met her years and years ago when she had her own business, a magazine business that catered to families. So she's an entrepreneur, and she's always had that spirit, but she's also been involved in government, different jobs in the government. I know that she recently joined the county leadership team in April a year ago, right during the pandemic. So she's a fighter all the way around. She previously was our community, served the community of Corona as the city manager of Eastvale, as well as the assistant city manager and acting city manager here in Corona. Her background is economic development, communications, public relations, legislative affairs, homelessness, regional initiatives, and other major programs. If you can think of anything and you need an answer, Michele is the go-to person. She is passionate about local government and considers herself a lifelong learner. I know that she works numerous hours any day. I can text her no matter what time it is, and she responds. That may be because she works for my wife, but she is very good at responding quickly for everyone. So ladies and gentlemen, please welcome for an update from Riverside County, Michele Nissen.
Good morning, Corona, and thank you, Bobby, very much for that warm welcome and very kind introduction. The main objective that I'm going to go over today is the county's vaccination campaign. And there's been some major changes, so I wanted to apprise everyone of that information today. So we have a combination of 14 vaccination sites and mobile teams active across the county. That does also include that does not include provider campaigns. We have 8 vaccination pods. Those are points of distribution. Those are large-scale vaccination sites. And there's 4 changes that are going to be made to the existing pod sites over the next 2 weeks. And one of them is going to impact Corona. So I wanted to cover that today. Next slide, please. The Indio site is going to be transitioning to Curative. I think many of you are familiar with Curative. They have initially been more on the testing side, but now they are entering into various partnership agreements with local cities to provide management of vaccination distribution. So India is going to transition to Curative. The Lake Elsinore site is also going to transition to Curative. And the Corona High School site is going to be phased out. So this is important. I know it does impact some of the Corona residents. And they're going to be establishing a new site in Moreno Valley, and that will open on March 8th. The Paris Fairgrounds site is going to transition to a COVID testing only site, and it is going to be open 7 days a week. Next slide, please. There's going to be one site in Paris that's an OptumServe site. So OptumServe is the state's platform. On Wednesday, March 3rd, the state's going to add 3 more OptumServe sites, one in Desert Hot Springs, one in Norco, and one in Temecula. So the Corona location that's being phased out is being replaced by the Norco OptumServe site that will be opening today, actually. The vaccine supply at these sites is not coming out of the county's allotment. And that's really important to know because the state does make a direct allocation to the county. And then from our allocation, we have been parsing that out to our medical providers that have been approved by the state. But these sites listed here, because they are state-run sites, will be getting their own direct allocation directly from the state. So there's one site in the city of Riverside that's a curative partnership with the city of Riverside. That's at the Riverside Convention Center. There's one site in Palm Springs that's at the Palm Springs Convention Center, and that also is a curative partnership. And then the county has 3 mobile teams deployed across the county, and those are specifically focused on reaching our hard-to-reach populations. There's 2 additional teams that will be added on March 5th. That's going to give us a total of 5 mobile teams that are operating throughout the entire county. Next slide, please. One of the significant changes that we have made to the county's vaccination website is to add some images of our dashboards. This is data that we're tracking for the state, but also for our constituents to provide some additional transparency and accountability with what's going on with vaccine distribution. So currently the county has received 511,170 doses. We've administered over 524,000. Now I know some of you are like, okay, the math doesn't add up. How is that possible? But we do have a lot of residents in Riverside County that are employed out of county, and they're getting vaccinated outside of Riverside County. But because they're a county resident, their numbers are showing up in our data. So we have a lot of first responders, for example, nurses, doctors that work outside. Their numbers are reported here. We have 197 state-approved providers with vaccine distribution. As you can see, there's some data here about the number of first doses, over 343,000. Second doses, over 137,000. And that's about 13.9% of our population in Riverside County, which is over 2.5 million, have received the first dose. Next slide, please. And here's some additional information that we are tracking. It helps the state also with their allocation, but this is also information that we've received a lot of questions about. You know, how many people that are female have been vaccinated versus male. You can see here that females are tending to get vaccinated more than the males. You also have a breakdown here on race and ethnicity and age group. So every day that our numbers are updated, these dashboard slides are also updated on the website. So you can look at that at your leisure. Next slide, please. And then here we have some population information about the percentage of the population that has been vaccinated by age. As you know, the county has been focusing on the elderly first because they are the most vulnerable to the COVID pandemic. So we wanted to try and provide them with the vaccination first and then step down the ages by 5 years. So right now we are currently in the age bracket of 65 and up. Next slide, please. So here is the current eligibility is the phase 1A, all tiers, which is healthcare workers, EMS personnel, home care providers, as well as phase 1B, tier 1, which is education, childcare, emergency services, and food and ag workers. And again, as I mentioned, 65 years and older. The state does additionally change the criteria from time to time, so the eligibility criteria will change at the county level when the state makes a modification. And you can find additional information on the county's vaccination website, which is listed here. Next slide, please. So how do we open up? This is kind of an important point. We had a lot of discussion about this yesterday at the Riverside County Board of Supervisors meeting. Although our testing rates are good and our vaccination rates are good and our metrics are trending down in the right direction, the state has pointed out that our testing rate is not good enough to get us into the lower tier. So we are currently in the purple tier, which means that the virus is still very widespread. In order to get into the red tier, we need to have a case rate of 7 per 100,000 and a positivity rate of 8% or less. So the state is saying you need to get back on your focus of testing. You've been focusing a lot on vaccination. Don't forget about testing. And the key here is that we need to hit the state's median for testing or better. The state right now is testing 386.4 per 100,000. And in comparison, Riverside County as a whole is only hitting 319.2. So until we hit the state's median of 386 or better, we're going to be stuck in the purple tier. So I really encourage everyone, whether you're symptomatic or not. Asymptomatic folks can get tested, and it is free. So please encourage everyone to go ahead and continue getting tested. Next slide, please. Want to conclude real quick by telling you that yesterday's big announcement was that youth sports and adult sports can reopen. So for those of you that have kids in the Corona Norco Unified School District or kids that are playing club sports, this was really great news. So we did issue a press release yesterday. You can find that on the county's website, as well as Supervisor Spiegel's social media platforms. And if you have any questions related to that, I'd be happy to answer.
Michele,
thank you again very much.
Michele, thank you so much, and I appreciate you taking time this morning. And again, if you, all of you that are on the call today, if you can just go to the chat box and chat, send it to the Corona Chamber host, that would be Stephanie. We'll go ahead and start asking questions. Stephanie?
Thank you, Michele. First question, can residents go to any of the sites that you mentioned for their vaccinations?
So are the changed sites, is that what you're referencing?
Yeah, so if they are eligible to receive a vaccine and they want to go to the Norco one or the Palm Springs one or wherever, are they eligible as county residents to choose their vaccination site?
So if you're trying to obtain your first vaccine, there is a list on the vaccination website, assuming that you fit into the criteria of the tiers that we are currently focused on. You can choose to go to any one of these sites throughout the county, and you will need to make an appointment. For those folks that are waiting for their second dose of the vaccine, there's two things to consider. Number one, if you got your first dose through a county public health vaccination clinic, you will be getting an email from the county letting you know, hey, it's time to go ahead and schedule for your second dose. So please watch for that email. The other important thing to note is that because of the vaccine supply, which is still a problem, we still don't have enough vaccine supply to meet the demands. We are stretching out the timeline for which you can get your second dose to about 42 days, which is, according to the CDC, is acceptable based on the vaccine data. So I know Dr. Fauci and a lot of other sources have been saying 21 days for Pfizer, I believe it is, and 28 days for Moderna, but they have now come out and said that up to 42 days would be acceptable. So again, if you went through a county vaccination clinic, watch for the email. If you obtained a first dose from, your medical provider or one of the county partners, you should be going back to that location for your second dose appointment. So it has a lot to do with where you got your first dose. There is also on the county's vaccination website a dedicated page to second doses, and they have highlighted all the dates of the first dose appointments that they are now scheduling for second dose. So please take a look at that page, and if you're a second doser, see where you fall.
Thank you. So if a resident received their first vaccination shot at Corona High School, will the second one be at the Norco site?
That's a great question, Stephanie. So yes, if you received your first dose at the Corona location, you're going to have some options. You will have the option of going to Moreno Valley if you prefer, or you can go to the Norco site. Right now, County Public Health is working with OptumServe, and the OptumServe is going to be running, I believe, the Moreno Valley site and for sure the Norco site. So they're working with the providers to make sure that there's continuity for the folks that got their first dose at the Corona location, as far as getting an appointment for their second. So they'll have some options.
Thank you. Why is Corona losing the vaccine site, and how can we get it back in the system?
So that's a great question. We had asked that the other day when we found out that the Corona location was going to be phased out. And I think it's because there's a location in Lake Elsinore that is not too far from Corona. And there was really nothing on the far west side of Riverside County. So the theory was to provide the Norco location, which gave greater access to Harupa Valley, Eastvale, and still Corona. So the Coronans could travel a little bit north, or they could travel a little south. They can go into Riverside. But for Eastvale, Norco, and Harupa Valley, there was nothing going on in those areas. So I think it was more for a balance throughout the county.
Gotcha. How are vaccinations going in Corona? Are the healthcare providers getting the vaccines that they need to stay on schedule?
It's my understanding that healthcare workers are getting the vaccines that they need, if that is the question that you're asking. The supply of vaccines overall for the entire county, well, the entire state is still an issue. You know, we have 2.5 million residents, and we're only getting about 55,000 vaccines a week, maybe at this point. So according to Dr. Leong's presentation yesterday, he would estimate that maybe by the end of summer, we will see 50% or more of Riverside County's overall population vaccinated.
Thank you. How do we track doses for residents of other counties? The slide that you had earlier mentioned doses received and doses administered track our county residents, as some of them were getting them outside of the county due to their employment. Do you have data on those that live outside of Riverside County getting theirs here because of employment?
That's a good question. I don't have an answer for you at this time. I know that when you register to get a vaccine, you do have to give, your address. If you're getting vaccinated through your employer, there's usually proof of employment and a letter, some form of documentation as to why you are eligible for a vaccine. That information gets entered into the state's database. So that has a lot to do with how those numbers are showing up on our data. But as far as the breakdown of all of county residents who are getting vaccinated outside of the county, I don't have that right now at my fingertips. I'll have to get back to you on that.
Okay. If the state levels drop lower than they are now, will the county be subject to those lower rates as well?
Can you clarify that question, please?
Statewide, like if the total number of residents in the state of California, whatever they track their, the rate of infection or
positivity
death.
rate?
Yeah, I think that's what the person is asking.
Okay.
If overall our numbers drop for our whole state, will the county have new metrics to measure upon that are lower to get into like next tiers and stuff?
So the state's metrics, as far as moving through the tiers, it's a combination of things. It's not just the positivity rate. They are also tracking the testing rate. So as you know, right now, our positivity rate is dropping. But what's keeping us in the purple tier is because our testing rates have not been keeping pace. We've been focusing on getting everyone vaccinated, and as more people get vaccinated, we think the tendency to continue testing sort of drops off. So it's really a communications and education and outreach push right now, is to continue getting tested, whether you are fully vaccinated or not. But to the second part of your question, will the state start looking at different metrics? That is definitely something that county staff are having ongoing discussions with CDPH about. That as the overall vaccination rates increase, you're going to see naturally people having more confidence in the overall environment as far as vaccine goes, and therefore a decline in testing, and that maybe we need to start looking at different metrics. So that's an ongoing discussion right now.
Thank you. Okay, there's 2 more questions in the queue, but we have time for 1 more, so I'm going to put the last one in the chat afterwards.
Okay.
Last question, will the county begin using the Johnson & Johnson one-shot vaccine?
So Johnson & Johnson was recently approved. I'm sorry, I'm trying to look through my notes. I do believe it is something that we're going to start deploying. I just don't have a date yet of when we're going to start getting the allocation of Johnson & Johnson, which is a one-shot vaccine. So it is going to be used, but I don't know when we're going to start using it.
Well,
Thank you so much.
Thank you very much.
Thank you, Stephanie. Thank you so much, Michelle. And the other question is in the chat right now. And if you can respond to that in the chat, that would be gratefully appreciated. And thank you for taking time today to be on the call with us. We really, really appreciate it. Donnie,
thank you for having me.
You betcha. Donnie, can you share about this next Monday's call?
I sure will. This Monday, March the 8th, on our Coffee with an Entrepreneur, we will be featuring Elaine Norland. This event is held in sponsorship with the City of Corona and features one entrepreneur's background and business story. Elaine formerly owned a cone zone before she sold the company to Road Safe Traffic Systems, the nation's largest provider of traffic control and pavement marking services. She will bring to you her wealth of knowledge that you won't want to miss this free program. I've known Elaine since she was 15 years old. She built this company. She's an incredibly talented woman who worked hard and really accomplished a wonderful business. And I look forward to hearing what she has to say. That's this Monday, March the 8th. And you can register today on the bit.ly that's on your screen right now. Again, this Monday, March 8th. Bobby?
Excellent. And Elaine's got a lot of information. You know, she sold the company to a large organization, and there's going to be some tidbits on how to build your business and be able to do the same thing. And then she's experiencing a couple of things that is a challenge to most business owners when employees decide to leave your employment. And so she's going to be sharing some key tips for each of you to kind of take note on. So definitely plug in. And that also marks, by the way, 365 days from when we started this whole pandemic. So it's going to be a celebration on Monday. Bring your coffee cups to our Zoom call. Thanks so much, Donnie. Our next slide is about our golf tournament, and I am flat out excited to share with you that we are almost sold out already. We just launched it 2 weeks ago, and the foursomes are going like crazy. So if you're interested in participating in the golf tournament, which will be Thursday, May 27th, there is a discounted opportunity for sponsorship of one type of tee sponsorship with a foursome, and that ends March 20th. We may be sold out before then. So please, if you want to be involved in this, connect with us. Go to the bit.ly that's on there, which is bit.ly Corona Golf Classic, and then you can get all that information. We are going to be honoring military that day, active duty, and if you'd like to help support that, you can sponsor a golfer, or you can purchase some tickets. Either way, you're going to be in for a drawing, and the top prize will be, now I've lost my spot on what it's going to be. Stephanie, can you help me out on the top prize?
The 50-inch TV.
Thank you. 50-inch flat screen TV. Second prize will be $200 of gift cards for local businesses, including eateries. You can purchase the tickets online. They're $25 per ticket. If you want to spend $100, you get 6 chances. If you want to do a $500 sponsorship, you get 40 chances. For every $500 we receive in that, it gets us one of those golfers, one of the active duty military, to be able to golf with us for the day. So again, March 20th is our cutoff for that special, and I anticipate we will be sold out by next week. With that, I want to slide on over to Donnie on membership.
You know, these business briefing calls that we do every week are a benefit of being a member of the Corona Chamber of Commerce. They're here to educate you, to empower you, to give you the information that you need to conduct business. If you happen to be on this call and you're not still a member of the Corona Chamber of Commerce, or if you know someone who should be a member of the Chamber, we would like for you to please contact Robert Yanez. He's our membership specialist, and you can become part of our Chamber family. Meetings like these are just one of the many benefits that being a member will help you with. We're an active and thriving organization. We serve a regional landscape. We're not bound by any geographical limits. We have incentives for both joining and referring people to join. And we have a special March Madness program coming this month that you don't want to miss out on. Our chamber is growing. We make a big impact. The more membership we have, the more influence we have, and the better we can represent the businesses of our region. So please contact Robert today. Bobby?
Thank you so much. So now I really, it's indeed a pleasure of mine to be able to introduce Jeff Gibson, who's been a sincere blessing to this chamber and to the business community. Jeff keeps a pulse on what's happening in Sacramento and Washington, D.C. And today, more than ever, do we need someone that has the knowledge and the talent to be able to navigate and kind of go through all the weeds to figure out what is happening. Jeff kind of dissects it on down. He sees things from a large perspective, and then he takes time every week to share with us tidbits and things that are happening. And oftentimes what is happening when he shares, it's so fresh and new that none of the media or other people have ever been briefed on it. And Jeff is on that late breaking information to us. He owns his own business, and it is called Occidental Communications Group. He is just a tremendous asset for us, and we're just glad to have him on this call. Please welcome Jeff Gibson.
Thank you, Bobby. I appreciate that. And in reference to one of the recent comments in the chat, I think everybody can keep their sharp objects on their desk. So the legislature is has been working for about a month and a half. It's passing major bills. There have been some pretty major rules changes in light of the COVID situation. One of those is a rule that a bill needs to be in print for 30 days. It was suspended for before you can take action on the bill. That was suspended on a bipartisan basis because of the legislature's need, or the legislature felt that it needed on a one-time basis to get through more legislation than it did last year. They were antsy for some social change, and so both parties got together, decided that it would be better to remove that that very important rule. And almost immediately, major pieces of legislation started to move through. One of those was SB 7, which we're tracking. We don't have a position on currently, which would suspend CEQA, so you wouldn't have to get an environmental review for major projects, something we like, if you followed a number of very, very stringent workplace rules, environmental rules, energy rules, and other policies that we haven't backed in the past. And so it's in the balance, one of those bills that there are things that we like about it, and the trade-off is that there are a lot of things that we don't like, but it was introduced and then moved through the Senate within about a week, where normally that process would take about 6 months. So there's going to be a number. The reason I bring that bill up, even though we're not taking a position on it, is that there are a number of bills that would normally be considered for 6 months, 9 months, almost 2 years, that we would have the opportunity to speak to on a number of different times. Those rules have all been set aside. So the legislature is going to be able, you're going to start seeing things like we talked about with SB 95 that we previously didn't see before, because you don't need to have 30 days in print. You can go the day you introduce it, so no one would have a opportunity to have read it. So it's a challenge. Both parties agreed to it. We're going to be living up to that challenge. The first bill is a proposed request for SB 213, workers' compensation increases for hospitals. Currently, California, as many of you know, as employers, operates on a very generous no-fault system, and which is just about as the most generous system known to man for workers and employees, and oftentimes very tough for businesses who are expanding to continue to afford. So we've worked very hard in this area for a number of years. For the entire time that I've been with you, it was one of the things that we talked about on the day that I first met with the LAC to consider doing the work that we're doing. So it's been with us for a very long time. It's going to continue. Unfortunately, SB 213 basically removes that no-fault system. On top of it, it also removes the employee's responsibility not to get injured outside of work. What it replaces it with is a 10-year system where any injury that occurs to someone 10 years after leaving the employ of a hospital or a medical facility, the opportunity to say, well, that was workplace related to my job previously at a hospital, and file a claim for 10 years outside of their employment. And it's just about for any injury that you would normally consider getting. It includes cancer, includes psychological issues, it includes soft tissue injuries, it includes injuries that really don't linger for 10 years, which is curious. Unfortunately, it's moving through the system very quickly. And generally what has happened with workers' compensation is that as one part of the system gets broken over in follow-up legislation, everyone kind of takes the once part of the system is broken, the rest of the system becomes broken. And so that's a huge amount of our concern. One, you don't want to be raising the price of human relations and setting this horrible precedent on hospitals and caregivers in the midst of a pandemic. And then two, you don't want to create a system in which you have a bad precedent out there that will then go to every other industry. So happy to answer your questions if you have them in the chat. Stephanie, was there anything on that specifically?
No.
So Jeff, I did want to just mention that I'm going to put in the information for Senator Roth as well as Assembly Member Cervantes to be able to have people outreach to them.
Absolutely, yeah. And this is the important thing. And one of those things that are the difficult thing or a challenge that's going to be one of the challenges that are going to happen over time with this system where bills don't have to be in print for 30 days is that it's going to be difficult for legislative offices to be up on each bill as they go through the process. As we've met with Senator Roth several times, and I know from my experience with him, he really does read legislation 4, 5, 6 hours a day. So he's very up on pieces of legislation. So there are a number of items that are going to be very difficult to do this year. In answer to one of the questions, thank you, Michele, for asking if it's related to COVID. No, it is not. It's introduced in an era that would be related to COVID, but it is a permanent change in the workers' compensation system. And it is not, and all of the health conditions that are listed don't have to do with COVID. So there isn't anything specific in the bill that other than it's introduced in a year that you would consider is tied to COVID. So,
okay, Jeff, we have one question in the queue right now. I'm going to have Stephanie ask it. Okay.
Sure.
We actually have two now. So the first one is, how can we fight these bills, and what is the chamber doing to help fight these job killer bills?
Okay, so first off, on the slides that are provided, the first thing we do is we agree as a group to oppose the legislation. Once that is opposed and we have the executive committee approve that. We communicate the opposition forward to the state legislature, and then we work with other employer groups to expand our reach with either other chambers or other groups of interest, and we work to fight that legislation. Now, what you can do individually is you can call your legislators. In the case of Corona, that would be Assemblymember Cervantes, and that would be State Senator Richard Roth, and tell them your position on the bill and how that it very likely will impact you. Both of those offices, I know, take that feedback very, 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 very specifically. So that is extremely successful, and those are the best ways to do this. We understand that the entire legislature isn't going to respond because Corona Chamber took a position, yes or no. But we work extremely hard after this meeting and the other 6 days of the week that we aren't preparing for this meeting to let people know in Sacramento, either through our direct communication or else, or through a network of our opposition or our support. So that is, and so anyway, we're working very hard for that, and I appreciate that.
So let's go ahead and do the motion as it's been recommended by our advocacy representative to
Sure.
oppose SB 213. And I know Mike Karashi was on the call and he had put in some comments. I'm assuming, Mike, you're making that motion. Is that correct?
Yes, that is correct, Bobby.
Thank you. Is there a second from someone on this call?
I see a second from Jeff Miller.
Thank you, Jeff Miller. So there's discussion that we want to have. So if any of you are, so when I use the word oppose, so I want to make sure the motion that we're going to do is to oppose SB 213. Is there anyone that is not comfortable with that for us to oppose? I'd like you to discuss it now. If everyone else is in favor of us opposing, I don't really need any discussion from them. So is there anyone that wants to discuss anything that would be a difference of what we're looking at? Stephanie, do you have anyone that sent a message to you regarding that?
No.
Okay, all those in favor then, I'm going to assume that you guys are all in favor. You can push it in and put for everyone either yes or no, but all those in favor signify by saying aye.
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 Is there anyone?
Aye.
Is there anyone opposed to what we're recommending? There is none. Okay. Is there any abstentions? Okay. So at this point, we have now approved that. We have approved that we're opposing SB 213. In the chat, you will see all of the contacts for Senator Roth and Assemblymember Cervantes. We would ask that you would go ahead and contact them. I noticed also in the chat, there was a request for a form letter. I believe that Jeff is crafting one up, and we will have that out to you in an email so that you can populate it and send it on your letterhead and get it off to those individuals as well. Jeff, is there other things that you wanted to share this morning?
Yes, just real quickly, another bill that is in the kind of the same space of healthcare, because this is something that we're doing a lot of focusing on. AB 1400, I wanted to bring to everyone's attention. It's a single payer healthcare. It has 18 members of the legislature acting either as author, co-author, primary co-author. They're very powerful members of the state legislature. So this is while other legislatures in California history have considered single payer healthcare, this is probably the largest group of people that have taken it, gone after this. Under this system, it would expand Medi-Cal, which is the care for folks that cannot afford any medical care for themselves. It's part of the federal Medicare system. It would expand So you would get that level of care across for every single person in the state of California. It would be required for every person in the state of California. You would not be able to have access to, likely have access to your private doctor, since most private doctors would probably not participate in the system and therefore could not see patients in California. It is, as we said, because there's no rule on a bill being in print for 30 days, and all of the other rules for how long legislation is supposed to sit so that people could consider it, and opposition and people in favor could have their opinions heard. Well, like I said, if SB 7, which basically sets aside CEQA for major projects, can be heard in a day and passed out of the state Senate, why not single payer healthcare? And so this is moving through the system extremely quickly. And we are very concerned about this, obviously. When this was considered and almost passed 3 years ago, the state legislature found that it would quadruple the size of the state government within 4 years. So since then, the size of state government has doubled already. So you can imagine what costs would already be underneath that. So we're going to be taking an opposed position on that, or proposing an opposed position on that. If we have a motion and a second, and interest in maintaining our current, we've opposed every time single payer healthcare has been proposed, we have opposed it. So this is in keeping with 8 years of our legislative background.
Excellent. Okay, so we do need a motion. And that would be a motion to oppose. Is that you, Chad Miller, that's wanting to make that motion? Yes. Okay.
Yes, sir.
Is there a second on the call?
I can second that, Mike Karashi.
Okay, Yolanda actually jumped in before you, Mike, and she seconds. So we now have a motion and a second. So again, I'm going to ask if there's anyone that's on the call right now that feels that we should not oppose this call, this motion of AB 1400. Is there anyone that wants to put in the chat or unmute and let me know? Stephanie, do you have anyone that's sent to you directly?
There's just a comment in the chat about the estimated cost to taxpayers for single payer is in the $400 billion range.
So it just keeps getting worse every time we turn around and we get more information on this. So I'm feeling that you guys are ready to vote. All those in favor to oppose AB 1400, signify by saying aye. Put it in your chats, voice it however you want.
Aye.
Is there anyone that opposes? Do the same thing. I would like a voice one if anyone is there to say no, they don't want to oppose it. Is there anyone that abstains? Stephanie, do you have any in the chat that has indicated any of those? Ladies and gentlemen, we are now opposing AB 1400. I appreciate you being on this call and taking this action. Jeff, did you have anything to wrap up with?
One last one on the federal aid package related to COVID. So we've heard a lot about the $1.9 trillion package. There are a couple of items that I want to point out. Of the $1.9 trillion, which makes it in the neighborhood of all the previous COVID-related relief acts. In those acts, which were bipartisanly supported, each of those acts had about 85 to 90% of the bill itself was going towards COVID relief, whether that was related to PPP or any of the things that each of us know very, very well. That was, so you're looking about 85 to 90% of those bills. You get a $2 trillion bill or a $1.5 trillion bill that passed a year ago or 9 months ago or 6 months ago. This is $1.9 trillion. The difference here is that only $1 of $8 has anything to do with COVID at all, or public health even. That 9% of the bill goes toward the famous or infamous $1,400 payment to every resident of the United States. About 1% goes toward accelerating vaccines. there's about 1%, 1 to 2% that can be considered for COVID generally, and about 4% for public health. The rest goes for all sorts of different items, including, and you may have seen, $140 million was inserted at the very last minute for a study of a rail tunnel between San Francisco and the Silicon Valley, and how that makes it into a COVID emergency aid package. What ends up happening, and the reason I'm bringing this up is not to complain, but to show you how policymakers are now migrating from, we are going to specifically focus on defeating COVID, into a, where if we can relate it to COVID, we can get our bill passed, which is an entirely different item, and which is on a much more normal basis, unfortunately, for how legislatures work. And that's not a comment on Republican or Democrat or anything. That's just how legislators work generally. They try and hook into the key issue of the day. The difference, of course, is they weren't forcing us to stay at home while they were doing that. We were out and were able to be moving about. We're indoors, obviously, because of a pandemic, and this is a very, very difficult thing to have to live through, especially given the way the pandemic is continuing to develop. When we met last week, about 3% of America's population was not under any sort of lockdown and was moving forward with what we would consider a kind of a normal level of business opportunity. When we meet next week, there will be about 50 million Americans, or about 22% of Americans will have almost all restrictions lifted. By the end of the week after that, you're going to be looking at nearly 50% of American residents could possibly be out from underneath the restrictions, and yet you'll still be in full debate on a $1.9 trillion aid package that won't take effect until July. So we're tracking that so that you guys can make your, and again, not making any comment on whether we should be out, should be in, everything's stringent, whatever it is. We want to present you with an employer's view so that you as employers and business people can take advantage of that research and make your own business decisions. And that's really where we're trying to come at this. Happy to answer any questions that you would have. And we will keep you updated on the things that we took action on today.
Thank you. Yes, there are a few in the chat.
Sure.
So one question asks what amount was allocated for the rail tunnel, but I also had a comment saying that another participant today read that the House Speaker removed the rail tunnel from the bill today.
I don't know how she could do that other than to ask the Senate to remove it. The rail tunnel was for $140 million. It was for a feasibility study of how to build a rail tunnel through multiple earthquake faults, including the Loma Prieta fault that essentially collapsed a good portion of Oakland and San Francisco in 1989, as you may remember. And so if she asked for that to be removed, it would have to be removed out of the U.S. Senate. So we will be looking for amendments because the bill was passed by the House and taken over to the Senate. So it might be removed in conference, but that's a much different thing. But I haven't heard that. I don't doubt that it may have happened, but I haven't heard it otherwise. But it is in the House version that was sent to the Senate, most certainly. And it's $140 million. So.
Thank you. Okay, next question. How likely is it that the one-payer system will pass? And if so, when would it take effect?
The one-payer system we are tracking. It is, I would say this is the most serious threat to have that pass. $400 billion was the estimate 2 years ago. If you remember, it passed the Senate and was killed in the Assembly. And the estimate was $400 billion 2 years ago. So that was before the pandemic. That was before the imposition of stockpiles, which are going to be coming for each and every employer. That was before all of the other impositions that are going to be staying in place because of the new reality of living in COVID. So, and that was before the size of California's government actually doubled in those intervening years. So we were spending about $170 billion, about $140 billion the last time we considered this. We're now spending $240 billion. Yeah, it would be extremely expensive, and it would start to take effect as quickly as possible.
Thank you. Okay, the final question for today was a request for more information on a different Senate bill that you didn't cover today. So perhaps for a future meeting, or if you have any references you can put in the chat. This person would like information on SB 626, the micro enterprise home kitchen operation.
Okay, yeah, I'll research it. And
we'll put that on for maybe next week then. Okay.
Yep.
So I did want to thank you, Jeff, very much. And I wanted to thank all of you for being part of this. Michele, did you want to jump on for something? No.
Sure. I can. I believe you have one additional question that you wanted some clarification on. Going back to the Corona vaccination site.
Yes.
The Corona vaccination site was not closed by direction of Supervisor Spiegel. It's being transitioned based upon discussions with CDPH, which is the California Department of Public Health, and county health officials. So they're trying to provide fair and equitable distribution and access to all citizens throughout the entire county. And if you map all of the vaccination pod sites throughout the entire county, there was a big void in Jurupa Valley area, Eastvale, Norco. And so with OptumServe already having a testing site in Norco, the CDPH and county public health felt that shifting the site to a few miles away in Norco would provide better coverage for not only Corona residents who can travel there, but Jurupa Valley citizens, Norco citizens, and Eastville.
Excellent. Thank you so much. Really appreciate it. And so, Donnie, you want to go ahead and talk about our sponsor for just a moment?
Yeah, once again, we'd like to thank today's sponsor, Awards and Specialties. They're more than just a trophy shop and are ready to handle any of your award recognition or promotional needs. Their shop is nearby. It's not like any other typical shop that you would go to. So again, thank you to Awards and Specialties, and please check their website, awardsandspecialties.net. Bobby.
Thank you so much. And our new chamber app is out. If you've got questions on that, or you want to get a lot better connection with us, this is the newest thing that we've got going, and it's pretty exciting. It is both available on Android and Apple, and you can post promotions for your business, see job openings, find out what's happening, and a lot more. Download it now and start accessing these new features. And Donnie, would you go ahead and cover next week's call?
I sure will. And if you would like to sponsor one of these calls, we would welcome you to do so. It's really a good reflection on your company. Please contact the chamber to do that. Please register now to join us next week for more advocacy news and information. And we would like to thank everyone for being on this call today. And we stand adjourned at this time. Thank you, everyone.
Thank you.